ACFD personnel should watch each other don PPE to ensure no steps are skipped and that all PPE is done appropriately using a buddy check prior to entering the 10-foot standoff radius with any suspected COVID patient. The following is a description of how to don and doff a Tyvek style suit should our cache of EMS disposable gowns become depleted. CDC guidelines and manufacturer recommendations were used in the creation of this procedure. The cache of Tyvek style suits that the ACFD may vary. As the potential to deplete our inventory as time goes on, logistics may resupply your apparatus inventory with any of these following models. Each of these models exceeds the minimum protection needed. First, N95 face mask, properly sized to your face. Place over nose, mouth, and chin. Secure ties or elastic bands at the middle of the head and neck. First, place bottom band at base of the skull. Next, place the top band at the crown of the head, but do not cross the elastic bands in a crossing pattern. Pinch the flexible band to tighten over the bridge of the nose. The mask should fit snugly to face and below chin. Always evaluate the seal effectiveness by making sure it fits comfortably. Next, eye pro. Place the eye pro on your face with the arms of the glasses behind your ears. Suit. Put legs in the leg holes, one leg at a time. You may need to utilize a chair or other object to steady yourself for this step. Next, put your arms through the armholes with the opening in the front. Pull up zipper to the top. If your model has a hood, pull the hood up onto the head. The next item is gloves. Don a pair of gloves over the top of the arms of the suit. Remember, if a glove becomes damaged, remove both gloves and replace with a new set. We'll now show you how to properly doff your PPE using a Tyvek suit. First, be sure to work from the top down when you're doffing the suit. If your suit has a flap covering the zipper, you must gently pull it open. Next, tilt your head back and reach for the zipper at the top of the suit. Grasp the zipper with 2 fingers of one hand, trying not to use the other, on the front of the suit and pull down. Unzip it completely. If your suit model has a hood, using each hand, grab the hoods at the temples. Pull outward to stretch the hood and pull back off the head. Roll the hood inside itself to minimize further contact with outer surfaces. If your model does not have a hood, you may skip this step. Use a decon wipe or hand sanitizer from the automatic dispenser to sterilize your gloves. Remove your gloves using the inside-out method. Grasp the outside of one glove with the other hand and peel off, turning it inside out. Hold removed glove in the hand that is still gloved. Slide a finger and thumb of the ungloved hand under the remaining glove at the wrist. Pinch and peel the glove off from the inside out so that the 2 gloves are inside out and wrapped up inside each other, making a single ball, creating a bag for both gloves to be thrown away. Touching the inside of the suit only, pull one sleeve of the suit down and off the shoulder and arm. Make sure not to touch the outside of the suit. Next, move to the other shoulder in the same fashion. Carefully withdraw your hand as you invert the sleeve and repeat for the other arm. Roll the suit down from your waist and thigh area to the feet, only touching the inside of the suit. To get the suit the rest of the way off, you may need to sit down in a clean chair. If needed, carefully remove your footwear, then remove suit over your feet and ankles. Grab the suit and pull it away from your body, one leg at a time. Once the suit is off, fold or roll into a bundle and throw away. A special note: if you cannot remove the Tyvek suit as described by yourself, ask a member of your crew for assistance and ensure the assisting crew member is wearing EMS gloves. iPro. Grasp on either side of the glass's arms where your ear meets the arms and remove. Place your safety glasses on the stretcher or off to the side, as these will be deconned for later use. Use cavi wipes or a bleach solution to clean your safety glasses. Next is the mask. Do not touch the front of the N95 mask. While leaning forward, grab the bottom elastic band, pulling it up and over your head. Use both hands to grab the top elastic band, pulling it up and over your head. Keep tension on the top strap. This will allow it to fall forward and off of your face. The final item is footwear. Consider spraying a disinfectant on the bottom of your footwear as they are possibly contaminated. A special note: the driver of the transport unit will remove the Tyvek style suit and gloves utilizing proper technique and discarding them in a red biohazard bag before entering the driver's compartment of the vehicle. Before entering the driver's area, the driver will place a new pair of gloves on, leaving the iPro and N95 mask on for transport. The patient's family should not be allowed to ride in the transport unit unless there is a pediatric patient involved. Additionally, the patient compartment vent fan, or the power vent, should be turned on during transport to help draw air away from the patient compartment area, make sure to close the window between the driver's and patient compartment area if equipped. When transporting a patient with flu-like symptoms to the hospital, notice that the gown has been removed prior to entering the driver's compartment, and all that remains are a new set of gloves, an N95 mask, and eye protection. If you are the transport unit driver, these are the following procedures to doff your reduced PPE. First, with the gloves. Consider using a decon wipe or hand sanitizer from an automatic dispenser to sterilize your gloves. Grasp the outside of one glove with one hand and peel off, turning inside out. Hold the removed glove in a hand that is still gloved. Slide a finger and thumb of the ungloved hand on the remaining glove at the wrist. Pinch and peel glove off from the inside out so that the two gloves are inside out and wrapped up inside each other in a single ball, creating a bag for both gloves to be thrown away. The next step is your iPro. Grasp on both sides with the glass's arms and remove. Place your safety glasses on the stretcher or off to the side, as these will be deconned for later use. Use cavi wipes or a bleach solution to clean your safety glasses. Your N95 mask is next. Do not touch the front of the mask. While leaning forward, grab the bottom elastic band, pulling it up and over your head. Use both hands to grab the top elastic band, pulling it up and over your head. Keep tension on the top strap, as this will allow it to fall forward and off your face. Finally, your footwear. Consider spraying your footwear with a disinfectant on the bottom, as they are possibly contaminated. After your completed transport and patient transfer of your patient, it's time for some personal hygiene. Wash your hands and then your face with soap and water immediately after removing your PPE. If you're unable to immediately wash your hands, use sanitizer, and then wash your hands and face at the earliest convenience. PPE for apparatus cleaning. When you have transferred your patient care, allow the transport unit to naturally ventilate for 5 minutes prior to entering it. Maintain security of the medic unit at all times. Don a new pair of gloves, only change them if they have signs of excessive wear or use. Decon the medic unit. Doff the gloves as previously described and wash your hands. Upon your return to the station, these are recommended actions. Doff your uniform and place it in the washing machine. If the location of washer does not allow doffing and immediate wash, the clothing should be bagged and then taken to a different wash area. Shower and redress in a new and clean uniform. With the exception of iPro, all parts of PPE should not be reused.